If we were to build an entirely new system that was void of this fear, void of loss of NIH funding or a tenure track or being sued like we heard in the prior panel, and let's call it like the Maha Science 2.0. I would love to understand from each of our panelists, what would the 3 principles, and I don't mean abstract principles, but in reality, what would that look like if we were to rebuild this, both in academia, in journals, but also as a researcher?
In addition to trying to reform existing institutions, we need to create new institutions, and so we have MAHA, we have CHD, we have IPAC EDU, we have new journals being created that are legitimate and authentic. We are creating new media outlets, and all of those things are really important to create, if you will, competition and alternative to something that's not right.
I think an important part of it is merit. I think we really need a return to merit and accountability. You do good science, you get rewarded. You do bad science, you do not get rewarded. I think that's the fundamental issue of any functioning, any well-run organization.
I think transparency is key. Right now, everything is so enshrouded, everything is so hidden. If you're a peer reviewer, and I don't like Jack's shoes, then I can. Your shoes are an homage to Ward Cleaver. They're so good. The peer review process is completely opaque. You do not know who reviewed your paper. And, damn it, when the peer review that I received back from a journal says that Dr. Hooker is an anti-vaxxer, period, end of sentence, I really would like to know who wrote that thing, because that's not a peer review. That is not acceptable. But, and data transparency. The data sets that have been enshrouded in the CDC, the vaccine safety Datalink, that I know personally has at least 10,000 unvaccinated children. It's total bullcrap that they can't do a vax-unvax study. They could have done it many, many years ago. They just refused to do it. But all of that needs to be crowdsourced. It needs to be put in the open public domain. You can do it without a HIPAA violation. You can do it with maintaining patient confidentiality. Anybody that tells you differently, spit in their eye on behalf of me, it's absolutely not true. We need this transparency.
So I've thought about this a lot. I mean, a lot. It's kept me up at night for years. I think for questions that are a matter of public health, where hundreds of millions of people are impacted on the outcome of the science, those corporations or entities, universities that have a chance to financially benefit should throw money into a big kitty. Then it could be matched by federal funds too. And then scientists bid to do that research on behalf of the companies, but the companies do not know who they are. And it's illegal for them to personally benefit, if I'm a scientist, to have a financial conflict of interest or develop one. My job is to issue a report and publish the report anonymously, so it's not about career development, publish or perish. I'm just bringing the bacon home to the university or wherever I am. All subject to the transparency that Brian was talking about. The data analysis plan first, put it on blockchain. Publish your data analysis plan and stick to it. Auditable, transparent, so that we know that the people doing the studies, if they have any bias, it's a personal bias for some reason other than financial or career.